Using the wrong blood pressure cuff size can lead to inaccurate readings, which can significantly impact your health. So in this video, I'm going to share with you my 5 top steps on how to choose the correct blood pressure cuff size and how to wear it properly. Studies have shown that using a blood pressure cuff that's too small can actually overestimate your systolic blood pressure between 5 to 20 millimeters of mercury, and using a blood pressure cuff that's too large can underestimate your blood pressure, your systolic blood pressure, by about 3.6 millimeters of mercury. Basically what that means is if you're overestimating your blood pressure, then you'll potentially be having treatment that you don't require or over medicating. And if we're underestimating your blood pressure, then it means that you might require treatment to lower your blood pressure. So that means you're at a higher risk then of heart attacks and strokes. So now let's talk about how you can ensure you're using the correct cuff size. Here's what you're going to need: a tape measure, and you can do this at home. Here's how you do it. So step number 1, find the midpoint of your upper arm using the measuring tape, okay? So how it's going to work is you're going to start it from here, the bony bit of your shoulder. It's called the acromion process if you want to Google it. All the way to the bony part of your elbow, which we call the olecranon process, okay? So you're going to measure from there to there, divide it by 2, and that is the midpoint of your upper arm. Easy as that. Straight on to step number 2, measure your arm circumference at the midpoint, okay? So I've got the measuring tape on that. As you can see, my arm is about 12 inch, the circumference of the midpoint. Now, you're gonna see on screen the cuff size table. This is for the A&D blood pressure monitor. Please remember the cuff size tables are different for different devices, so you need to find your own. But if you want, you can pause the video, look at this. For example, my circumference was 12 inches, so for me, I would use the standard wide range adult cuff size, okay? But remember again, they do differ the sizes, so make sure you check the one that's for your device. Moving straight on to step number 3, so based on the circumference that you've just calculated, you're now going to choose the right cuff size. Please remember, most blood pressure monitors come with the standard wide range adult cuff size, like this A&D one for example, but if your arm is slightly larger or smaller, you may need to purchase an additional cuff that fits you properly. Now before I share how to wear your blood pressure monitor cuff properly, I just want to give you a pro tip about blood pressure monitors and making sure that your monitor is clinically validated for accuracy and is on the validated device list, which we call VDL for short, by the American Medical Association, Hypertension Canada, or the British and Irish Society of Hypertension. Because believe me, a lot of the blood pressure monitors that you can buy online on Amazon are not on this list, so it means they're not accurate. Now, I've been using the A&D medical blood pressure monitors in practice for years now because 1, they are a workhorse when it comes to blood pressure monitors, and believe me, and 2, they are clinically validated by all the organizations I've just spoke about. So they do a formal study comparing the results of their monitor against basically the old school way, the manual SFIG and stethoscope, okay? And they all come out accurate. And the A&D Medical team are very good friends of the channel. To learn more about A&D Medical and about their brilliant products, I will leave a link to them in the description below. A&D Medical, thank you for being our trusted sponsor. Okay, so wearing your blood pressure cuff properly, step number 4. So put your arm out straight, palm facing upwards, okay? Put your cuff on, and basically you want it to be 2 fingers above the elbow. That's the placement. And when you're tightening it, it needs to be closed tight enough so you can just about fit 2 fingers in there. If you can fit more than that, it's too loose. And if you can't fit 2 fingers because maybe the cuff's too small for you, that is a clear indicator that cuff is not your size. Step number 5, cuff position. This is very important, okay? Some cuffs come with a little dot, some come with a little arrow. You align it with your middle finger. Also, always make the tube run down your arm through your middle finger like so, and then connect it to your blood pressure monitor. The reason this is so important is this has to be in the right position so it can detect little vibrations that allow the monitor to work out your blood pressure. If you don't have this in the right position, you're not going to get accurate readings. And also make sure don't block your tubing under your elbow or anything like that. Again, it's going to give you inaccurate readings. And one thing that I really like about the A&D blood pressure monitor cuffs is this sizing band. So let's say if your arm circumference was this big, for example, when you then close it, you'll see that this arrow points within the sizing band. If it is out of that, then it's indicating that that cuff is not the right size for you. And one last thing, if you're wanting a full step-by-step instruction of how to use your blood pressure monitor and all the do's and don'ts, I have a video on it which I go through in lots of detail, so definitely do check it out. Link in the description. Sending awesome vibes.